Today let's talk about some common arthritic deformities of the foot and ankle. And let's start with the ankle itself. And the ankle, as you probably know, is the junction here where the foot comes off of the tibia and fibula. And again, it's a very common disorder. If you've had an old ankle fracture or an old injury or repeated ankle sprains, the ankle tends to wear out over time and it forms ankle arthritis. And how do we treat that? Generally, we try to treat that conservatively with braces and anti-inflammatories and shots. And if all that fails, you either have to fuse the ankle, meaning lock those bones together, or do an artificial ankle. And now they're developing a pretty good artificial ankle for that. Next is a Talo-navicular arthritis. It's really close to the ankle. A lot of people come in with Talo-navicular arthritis that think they have arthritis because there's just about a finger breadth difference in those two joints. But it's a very common ankle arthritic area right below the ankle that people complain coming in with ankle arthritis, which is actually the joint below that. And again, there's not much we can do for that conservatively other than anti-inflammatories and braces, and if that fails, we have to fuse that joint. Down here is the midfoot. Again, a very common disorder, happens in women more than men, but basically you hurt in this kind of mid area of your foot. Again, conservatively, we try to treat that with anti-inflammatories and shots and stiff shoes, and if all else fails, we have to fuse that or grow those two bones together. There's an arthritis of the great toe. It's called hallux rigidus. It's essentially an arthritis of the great toe. You may stub your toe when you're younger, but it removes the cartilage of the great toe, gets stiff, and it also hurts and aches and swells on the top of the toe, not the side. And that's a very common disorder. It happens usually when you're younger or you play sports and you scuff the cartilage off the great toe. But again, it begins to get a little bit more stiff and a little bit more achy. It bothers you initially with sporting activities, and later on it bothers you all the time. And again, the conservative treatment is occasional shots, anti-inflammatories, and stiffening devices in your shoe. Another common arthritic area is the subtalar joint. It's another joint right below the ankle. It more handles the in and out motion of the ankle, not the up and down. Very common disorder, and again, we treat that with anti-inflammatories, occasional shots, braces, and if all else fails, surgery where we fuse that joint.